So how to benefit from health insurance and save money on medical costs and bills? This is a million-dollar question, and today I would like to share with you how you can save lots of money on healthcare even if you have the best health insurance in the world. This is especially helpful to those that have an individual health plan or a high deductible health insurance plan. So, for the last 10 years or so, the cost of insurance and healthcare has doubled. I've seen the rates go up before my eyes, even in the past few years. Even the most basic bronze plan could cost as much as mortgage payment for a month, if not more. So here are a few tips that will help you manage the cost of health insurance and spending on healthcare. Rule number 1, if you want to save money on healthcare, then you need to have health insurance. That is simple. Even though health insurance is expensive, paying 100% for healthcare bills is outrageously impossible. So yes, think about it. Don't risk your finances. Believe me, insurance is worth it. Rule number 2, know your plan. Really, when I ask my new clients what plans did you have last year, only a few can tell me more than the name of the company that sold them this plan. If you don't know what you have, how are you going to use it? This is very, very important. The best way to learn your plan is by reading the summary of benefits. Ideally, you should read it before you buy this plan. In any case, this document is like a contract or like a menu where it is outlined what is covered by your plan, what's not covered, how much your copay is, what is the deductible, what is the coinsurance, and so on. If you don't have access to this information, you either don't use the plan to your advantage or you end up paying more money than you should for features that you might not even need. Again, learn your benefits. If you have no idea where to start, talk to your insurance agent or broker. If you don't have one, I will be glad to give you an overview of your benefits and be your agent if you want. By the way, agents don't charge a dime for their services, and by working with an agent, you won't pay more in premiums. Really, agents are a professional free resource and it's wise to use their help. Okay, so let's move on to rule number 3. Compare your options. Compare plans and companies. Don't get stuck with one plan and one company forever. The premiums change every year, and if you don't keep your eyes open during the open enrollment, you might end up overpaying for your health insurance for next year. So shop and compare options, HMO versus PPO, Kaiser versus Blue Shield, and so on. Rule number 4, be aware of any health plan changes. Something that may have been covered last year may not be covered this year, or better yet, maybe your plan offers more free preventative services or screenings this year. Take a few minutes and look over your plan documents. I know reading insurance contracts is not quite an activity for a Friday evening, but it could save you lots of money. Again, talk to an agent and get their perspective. This will save you some time and free up you on Friday night to do more interesting things with your time. Rule number 5, use in-network providers. This may sound obvious, but you wouldn't believe how many people end up paying thousands more than they should because they used an out-of-network provider. Check with your insurance company before choosing a provider, a doctor. When your doctor refers you to a specialist for care, don't assume the specialist is in your network. Always check. You'll pay a lot more to see someone who is considered out-of-network. If you have Medicare, make sure you choose a provider who accepts Medicare reimbursement. If you choose a provider who simply participates in Medicare, they may file your claim but charge you later. For Medicare, I have a special dedicated section, so if that applies to you, make yourself a favor and explore our educational videos on this topic. So let's move on to rule number 6. Keep track of your receipts for qualifying medical expenses. If you haven't already, make sure you've gathered all receipts for any qualifying medical expenses you used your FSA or flexible spending account to pay for last year. You should have those handy for tax time. If you don't have an FSA or have no idea what it is, feel free to watch my video and get all the advantages of this plan. I also have a video about the HSA, which is a health saving account. This is an amazing account that has many benefits and advantages. This account can save hundreds of dollars and it's absolute favorite if used accordingly. Perhaps there are many other rules, so in case I've missed something, feel free to add it. I will appreciate it. Thanks everyone for watching. Stay healthy, happy, and insured. And obviously, please subscribe to my channel for educational videos on topics of insurance, personal finance, saving money, and so on. Shopping deals. Thank you very much.